Hi, I'm Dr. Lady Dy, and I'm a dermatologist, and my practice is in Glenview at Dy Dermatology Center. My practice is primarily, I do both medical as well as cosmetic. My focus is on non-surgical hair restoration. So I do a lot of things that is non-surgical. So, for example, treatment like medical management, low-level laser light therapy, microneedling, ultrasound technology called TED, which stands for transepidermal delivery. I do some laser-assisted drug delivery to enhance growth. So I do pretty much everything except for surgical hair restoration. Definitely, we always like to do a multi-modal type of a treatment approach. We use, supplements to hair care, growth products. Yeah, before I used to Grotrack, I didn't really have a, I would say, uh, other than global photography, that's what I've used, but I did not really have a way to quantify like a device to do quantitative analysis before Grotrack. And that is the reason why I, adopted Grotrack in my practice. It's very important to have a device that can quantify your hair growth. You'd be surprised as to how often patients forget about their baseline. So to be able to show patients their progress through their treatment, it is extremely important. So to have Grotrack do that, that has been tremendously helpful for my practice. The issue with hair loss, that this is a chronic condition. So this is not a condition that we have a cure for, unfortunately. So often, in order for a patient to do well in the program, it is something that they have to consistently do throughout their lifetime. And so to be able to show patients their progress or to track their progress using Grotrack, it makes my life, easier because I can show them their progress. But not only that, it reinforces and enhances patient compliance because, as you can imagine, when they have to go through all these treatments or they have to adhere to all these treatment protocol that I put them through, it's human nature, you get tired, but to be able to show them, hey, each time they come in, this is the progress that you're seeing, it's very gratifying and reinforces that they have to do the things that I tell them to do. Yeah, I like the Grotrack because, for several reasons. It's very convenient because it's portable, so I can go from room to room, just carrying the device. I could delegate it to my assistants. It's fairly easy to use. Just like any device, you do need to have a learning curve, but it is not something that, you have to take 45 minutes to do, So, to me, it's been great because I can delegate it to my assistants. So, as I said earlier, I use Grotrack for a lot of different types of treatments that I use, really any treatment that involves tracking the hair growth process, but I particularly use it with the TED procedure that I do, and TED stands for transepidermal delivery. So this is the device made by Alma that uses acoustic pressure along with the low frequency ultrasound to enhance the delivery of the hair growth serum into the scalp. So it's been, I would say terrific because when I'm able to, so, I use my Grotrack when patients first come in, establish their baseline, and then we typically give, or I typically treat the patients with 1 monthly treatment, anywhere from 3 to 4 treatments with the TED. And I do a baseline measurement with my Grotrack of their hair growth. And then I also do another one at the end of their treatment series. Well, it reinforces the positive outcome. So when patients can actually see the numbers, tangibly, see all these results, be able to if I'm able to present it to them, their global photography as well as their numeric progress, the more data you can show the patient, the better it is for, both patient compliance as well as for me, because it reinforces or positively enhances, their, I would say. So by using the Grotrack device, being able to show patients their progress, so each time the patient comes in, I can track and show them that they are actually indeed regrowing hair, that then in turn positively reinforces them so that they are more eager to come back and get more TED treatments. So that's how I've used my Grotrack essentially to, get or have the patients continue, to get more and more treatments, because these patients are all going to need maintenance, because again, there is no cure to hair loss. And, so it is something that in order for them to continue to get the benefits, they have to continue the treatments. And having the Grotrack device allows me to tell my patients you need more treatments, and they then in turn feel so comfortable signing up for more treatments.